My name is David Pinsinski. I'm owner and founder of Artemis, Colorado Vein and Cosmetic Center.
And I'm board certified with the American Board of Internal Medicine and diplomat with the American Board of Venous and Lymphatic Medicine.
The reason I started Artemis is I wanted to fix people and I wanted to fix their legs. I wanted to do these similar procedures where I could actually fix somebody. The outcomes with vein treatments are exceptional, and that's why I chose to start doing veins and treat veins. People get better and they're happy. And that is a very rewarding experience to do that, to be able to change somebody's life. There's no reason that you need to live with leg pain. If you have symptoms in your legs, leg pain, swelling, aching, cramping, restless legs, burning, numbness, bleeding, varicose veins, ulcerations in the legs, dermatitis, eczema, all of these things are symptoms of vein disease. So for those of you that come in to see me, you're going to have one of three problems in your leg. You're going to have either only spider veins, which are the little veins in the legs that look like spider webs. That's why we call them spider veins. You're going to have the more rope-like veins. Those are called varicose veins. Or you're going to have a combination of the two. The treatments for both of those types of things are different. Spider veins. It's primarily a cosmetic concern. The insurance is not going to pay for these types of treatments. The treatments are very simple. All we do for these is we just inject medicine into these veins to close them. Unfortunately, it typically takes multiple treatments to get a good result. You can expect at least 2 treatments. Some people will take 1 if they're small amount, but if you have more, it's going to just take more. Each time we do an injection, we only close about 50 to 60% of the veins, maybe a little bit more. And that's why you need a second treatment. And it does take time. For those of you that have varicose veins, to treat those, you're typically going to have a problem underneath, almost all the time. You will have a problem with the veins underneath the leg, the ones that you cannot see. And that's when we use our ultrasounds to diagnose the problem. And then the treatments for those types of problems is we start from the inside and work our way out. So the first thing that we would do is the laser ablation, which is where we put a small laser fiber inside the vein through an IV. We have the laser fiber in place, then we numb up around the vein itself, and then we pull that laser fiber out. And as that laser fiber comes out, it closes the vein off inside the leg. We don't take it out, we leave it in. Then for the bulging veins, we take those out by a process called microphlebectomy. These are micro incisions, very tiny incisions that we make in the skin, about 1 to 2 millimeters, maybe a little bit wider. We put a tiny little hook up underneath the vein and we just tease that vein out. After we go through that round of treatments, the next step that we do is a lot of you may still have residual symptoms in the legs, and if you do, you'll have branches that we just miss because you can't see them. They're underneath the skin there and they're still diseased. The way we treat that is we do injections. That's called sclerotherapy, is how we do those treatments. We inject medicine into those veins that's designed to close those veins. So the medicine goes into the vein itself. It irritates the inside lining of the vein and it makes it sticky, kind of like, I like to think about it like tape. So that way when we put compression on, it closes itself together and the vein sticks closed. So in a sense, I'm kind of gluing the vein shut. Not really, but that's what the medicine is kind of doing, is it irritates the vein, causes the vein to get sticky, and then we tack it closed like that. After we complete those treatments, typically probably all of your symptoms will be gone at that point. Then we can start working on the cosmetic treatment. Now you flip back into that first category where you got spider veins that are still left down your legs. How do we treat that? Well, back to what we just talked about, back to the injections again. The first one that we're going to be doing is the laser ablation. And that's what we want to take care of, this vein here. In the leg, there are 2 systems of veins. There's a deep vein, which is this vein right here. That's your deep vein. It sits down by the bone. It's your femoral vein. It's the most important vein in your leg. What we are concerned about are the superficial veins. That's this vein right here. Comes off the deep vein, comes right down to here. That is the vein that we are interested in. Now, the way that we close this vein is I use a laser fiber to do it. So how do we do that? Well, what we do is we put a small IV right here inside this vein right here. Same IV that you would get in the hospital. If you were to get one in your hand or in your arm, same IV. It's just a little bit longer because it has to go into the leg. Once we get the IV in place, I put a tiny laser fiber right up inside the vein through that IV, right up to about this point right here. We don't want to go into that. We don't want to go into the deep vein. We stop short of it. Once we have that laser fiber in place, we put numbing medicine around the entire vein, so we numb the whole thing up. Once we have that numbed up, we turn on the laser. We put the laser fiber in the machine itself, which pulls that laser fiber back at a constant rate. As that laser fiber comes out, it closes this vein off inside the leg. We do not take the vein out, we leave this inside the leg. Over time, your body will reabsorb that vein and it'll be gone. It'll be just like you were never born with the vein. Now, for those of you that have the bulging veins that are on your skin, these ones are out over in here. A lot of times in the calf, they can really be anywhere in the leg. We treat those a little bit differently. We use what's called phlebectomy. Microphlebectomy is how we do it. All we do is we numb this area up where this bulging vein is. We make tiny, tiny paper cuts in the skin about 1 to 2 millimeters wide. Just enough to get a tiny little hook right up underneath that vein, and we tease that vein through that little micro incision, and we pull the vein out. That is not a stripping, it's called a phlebectomy, but then this vein, all these little veins here will end up being gone. So the little micro incisions that we make are so small we do not sew them up, we don't stitch them. They will heal up just fine. You won't have any scars when this is all said and done. After we complete these procedures, the initial set, then we do what I like to call cleanup, which is injections of medicine into the remaining veins that you may have down here inside the leg that you can't see. We also do the same injections for those of you with spider veins to take care of those as well. So when you come into Artemis for the first time, you're going to need an ultrasound. That's the eyes. That's how I'm able to see into the leg, is we use ultrasound to do it. Ultrasound has been around for a number of years. Excellent tool for us to find where the problems are in your leg. So the first visit that you have is going to be an information gathering visit. We do an ultrasound, a formal detailed look at the anatomy of the veins in your legs. Both the superficial system and the deep system gets looked at here at Artemis. You're also going to get a detailed history and physical as well. Here at Artemis, we look at the whole patient, we look at the whole problem. So yes, we are going to treat your leg veins, but a lot of times if there are other problems that are not attributable to veins or something else, we're going to get you in the right place, and I'm going to get you to the right physician that can be able to help out the other problems that you may have that may be causing problems in your legs. After you've done the 3 months of compression, we're going to get you back for a follow-up visit. We'll take a look. We're going to go through the procedures that we're going to need to do, what we find, and then we're going to discuss those options at that point in time. Then we'll submit to the insurance company for authorization to do the procedures, and then we'll get started and we'll treat you. All the procedures are done in the office. You are awake when we do this. I don't sedate you. So if the patients are anxious, we do offer a Valium that'll help calm them. The procedures are very quick that we do. We are typically done in 25 minutes or less. It typically takes longer to get you cleaned up and set up and cleaned up after the procedure than it does for me to actually do the procedures themselves. We have everything in-house here. I have my own registered vascular technologist who's been doing ultrasonography for vein disease for almost 30 years. We have our own state-of-the-art ultrasound machines here at Artemis to diagnose and effectively treat the problems that you may have in your legs. On the procedure day, you'll come in relaxed, eat a normal meal. You don't need to fast for any of these procedures. You can drive yourself in here. Obviously, if you've taken a Valium, you'll need to have a driver. You are awake during the whole time for the procedures. After the procedure is over, your leg will be cleaned up and you're going to have a tight compression stocking on your leg, and your leg will be wrapped for 48 hours. At 48 hours, you'll take the wrappings off. You'll still wear the compression during the day for the next 5 days. So for a total of 7 days, you'll be in some form of compression. We'll see you back the next week, and if there's any more procedures to do at that point in time, we'll address those at that time with our follow-up ultrasounds. Once we've completed the procedures, we'll get you back in here, and typically after all of the underlying procedures are finished, then we can start the cosmetic treatments after that. The way vein treatments work is you have to treat from the inside of the leg up to the surface. A good analogy for that is if I told you I wanted you to dam up the Mississippi River, you would not go to New Orleans and try to block off every little point of that delta. What you're going to do is you're going to go to St. Louis and you're going to put a dam right at St. Louis. And that's going to shut the flow off for the remainder of the United States. It's exactly what we do with veins. We do the same thing. I got to shut the flow off underneath, correct the problems underneath, and then we gradually stair-step our way back up to the surface. If we try to treat from the top down, we'll be doing that for the rest of your life and not getting anywhere. All of the treatments here at Artemis are customized for every patient that walks through the door. We will diagnose the problem, we will figure out where your problems are, and we will tailor our treatment plan specific for you. Treatments are essentially pain-free, Most you're going to feel is a little mosquito bites on your legs and a little bit of burning as we numb these areas up. Once you're numb, you will not feel a single thing. After you've completed your treatments here at Artemis, you'll be in a compression stocking for a week, light activity for 3 to 5 days. What that means is you can go to work, you can walk the dog. It's easier to tell me what you can't do. I don't want you running a marathon. I don't want you riding a century on your road bike. Don't really want you on the Smith machine or the squat rack. Certainly no MMA cage fighting, and try to stay out of the terrain park on your snowboard, those types of things. We don't want you doing for 3 to 5 days. You can do all your normal activity, but after about 5 days, you do whatever you'd like at that point in time. The majority of our patients will have a little achiness for a couple of days. All pain is controlled with ibuprofen. We do not use narcotics. It does not work for this kind of pain. Compression stockings and ibuprofen is what the majority of our patients will need, and they all do very, very well. You can go to work on the same day that I do the procedures. We have a lot of patients that do that. If you are in a standing profession, I'd like to have you take maybe 1 day off of work just because it makes it a little more comfortable for you, but that's not necessary. You could still go back to work on those days. Risks of doing our vein procedures are extremely rare. The more common risks are going to be bruising, infection, clots in those superficial veins that hurt really bad. Those are going to be your more common risks. Those all go away. Other risks, numbness, clots in the deep vein, those are all extremely rare. After you've completed your treatments here at Artemis, pretty much all of your symptoms are going to be gone. If they're not going to be gone, we're going to do everything in our power to get those symptoms to go away. That is our goal here at Artemis. We want to get you pain-free. The majority, almost all of our patients are pain-free after their round of treatments are done, and they're very, very happy with the results. It's minimal pain, minimal risk. It's really a win-win-win scenario. And the other thing that we value here is you, the patient. That's what we're about. We're here for you, and that's really what it comes down to. If you have a problem, we want to fix you, and we're going to do everything that we can to do it.
My name is Pete. I'm a landscaper, and I'm on my feet all day, every day. And the problem would be when I go to sleep at night, I couldn't sleep. And I thought it was restless leg syndrome, but it wasn't. It was vein disease. And so the pain and lack of sleep were the two contributing factors for me coming to Artemis. I didn't know I had venous disease until I met with my doctor. My father had it for years, but never did anything about it. And I didn't really care about it, but it just kept hurting and hurting and hurting, and I didn't understand why. And then my doctor had said, wear compression socks, and if that doesn't work, then he referred Artemis as a solution. So I came in for the initial treatment, and then I came back for a follow-up, and that was it. My recovery was almost instantaneous. And my life now is just completely different. I'm able to sleep, I have zero pain, and the leg looks great.
Hi, my name is Sandra. For 14 years, I was in the landscape industry doing garden maintenance. So on my feet from 6 to 8 hours a day, bending, squatting, walking, you name it, I was doing it. I was dealing with varicose veins in one leg that were becoming quite unsightly, and really wanted to do something about it. I had a bit of discomfort, and I guess I didn't even realize that it was from the varicose vein. I came to Artemis and they talked me through the procedure. The team here is great. I had the procedure done and I couldn't be happier with it. I have no pain whatsoever. It looks fantastic now. I'm really happy with it.